So Hannah, what do you know about the patient we're going to see today?
Well, it says in the referral here from the GP, Kiara's a 12-year-old girl with diplegic cerebral palsy. The referral is requesting a physiotherapy assessment and as her gait's deteriorating and she's got leg pain.
And do you know how long those symptoms have been of concern?
It says here about 3 weeks.
Okay. And do you know what diplegic cerebral palsy means?
Diplegic means that both sides are affected?
Yes, it means that both of her legs are predominantly affected. Has she had any investigations through her GP?
She had an x-ray of her legs, but there were no fractures.
Okay. And do you know of her other medical history at all?
Kiara was born at 29 weeks and she had bilateral grade 3 IVH.
What is IVH?
I don't know.
Okay. It stands for intraventricular hemorrhage, which is bleeding to the brain. And this has caused or led to her cerebral palsy diagnosis. What about her surgical history?
I think she's had a hip operation and some sort of eye surgery as well.
Okay. Anything else?
No, that's all the information I have from the referral.
Sure. What details will you need to gain for your subjective assessment then?
I need to ask some more questions about her leg pain symptoms, and I want to ask how it's affecting her walking, like if she can still walk.
And what do you think might be important about her changes in walking ability?
It might be affecting how she's getting around, like maybe she's getting carried around or she's in like a wheelchair.
Yes, but think about it more in terms of her participation in daily activities.
Okay. Is that like going to school and doing stuff at home?
Exactly.
Okay.
What other history do we need to gather about Kiara?
Well, we already know her medical history and a bit about her surgical history.
Do you think we have enough details about that?
I guess I could ask some more questions about that.
Okay. Do you know whether there are any other services already involved in her care?
I guess I could ask some more questions about that too.
Great. Okay, let's bring Kiara in. Her parents have already consented for a physiotherapy student assessment today.
Okay.
Hello.
Hi.
Hello.
Hi. My name's Hannah. I'm the physio student. Are you Kiara?
Yes, I am.
Okay.
And I'm her mum, Alex.
Okay. And this is my educator, Richelle.
Hi.
Hi.
So I understand Kiara's been having some leg problems.
Yeah, she's been saying that her legs have been getting quite sore lately.
Yeah.
Okay. And how long have they been hurting for?
I'd say probably about 3 weeks.
Okay. And was it sudden or gradual, like them starting to hurt?
I can't honestly remember, but probably gradual, although it's been a bit more over the last week. We've just been really busy unpacking.
Yeah.
Yeah. Is it worse during the day or the night?
So
I don't really, yeah.
probably during the day. She's not really waking at night time.
Yeah.
Hannah, it might be a good idea to ask Kiara the questions directly. Alex can always step in and clarify if needed.
Yeah, okay. So do your legs hurt all the time or just sometimes?
They hurt all the time.
Okay.
Are there any other symptoms you want to clear before you move on?
I don't think so.
Have a think about your red flags.
Do you have any funny feelings in your legs?
No, they just really hurt.
Okay. What was the operation that Kiara had on her hips?
So the orthopaedic doctor cut her thigh bones and turned them outwards, and then about a year later they took the plates out.
Yeah,
Right.
it's round
Is Kiara taking any medication?
Just Panadol for pain, and occasionally we have to use some Novacol if she gets a bit constipated.
Okay. Do you need to help Kiara with activities around the house?
Yeah, occasionally. We definitely need to remind her to put the dishes in the dishwasher. That's your job, isn't it?
Yeah, that's my job.
Okay. What about like getting dressed and having a shower and that kind of stuff?
I'm pretty okay with that. I just need Mum to help me balance when I'm putting on my pants.
Okay.
And sometimes when she's showering, she just needs to sit because it gets a bit tiring, hey?
Yeah.
Okay. Is the pain stopping you from walking at all?
Yeah, a bit.
Okay.
A lot. Yeah.
Yeah, she's only managing about 100 metres at the moment.
Okay. So are you still walking as much, or?
Well, I try to do as much as I can because when I'm sitting down, I just get, so.
Okay.
Hannah, it might be worthwhile asking Kiara in what environments she uses her walker and what distances.
Do you use your walker?
Yeah, but mostly at school because I don't really have good balance when I'm on grass and uneven land.
Yeah, at home she can manage to walk around the house a fair bit, just using the furniture for balance.
Yeah.
But
So
anytime
she-
we go out, we need the walker.
So does she use the frame at home at all?
No,
Not
not very
really.
often. It's only mainly at school because I have to.
Okay.
Do you want to find out more about participation at school?
Yep. What grade are you in?
Oh, I'm in grade 6.
Okay.
It's really fun.
And you just moved here?
Yeah, we've just moved.
Yeah, we moved here about 6 weeks ago for work.
Okay. I think that's all I need to ask.
What about any previous services Kiara may have received before coming to us?
What about the physio at the children's hospital?
We see everyone. It's just, it takes so long when we see them and it's just
It sure
really
does.
annoying.
Yeah, we go up to the hospital about every 6 to 9 months or so. She gets her Botox as she needs it, depending on how she's going. And when we're there for ages, aren't we? We see the bone doctor,
And
the eye doctor, the rehab doctor, the
And-
orthotist, the physio.
Yeah.
Anyone else?
no, that's pretty much it.
Yeah.
Okay. Okay.
Just going back to what Mum was saying before, do you want to find out what muscles are being targeted with the Botox?
Yep. So, does Kiara have the Botox injections in? Like, where does she have them put in?
In my calves. And yeah, the needles are so annoying. I really hate them, but
She's very brave. It's usually her calves and her hamstrings, and we often need it a bit more on the left.
yeah.
Okay.
When was it last done?
I think it was about 4 months ago.
Yeah.
Yeah.
Okay. I think that's all I need to ask.
Hannah, is there any other equipment you want to ask Kiara about?
No, it's all the good equipment she uses.
What about her AFOs?
Oh, that's right. Kiara, what about your AFOs?
They started to hurt me right on my bony bits and my ankles. They're just really uncomfortable, and I think they're the worst pair I've had.
Okay.
Yeah, they're starting to get really hard to put on, and they're rubbing down here, and we're finding it harder to put a heel down into the back of it.
Okay. Well, we can have a look at that. I'm just going to go and talk to Richelle before we do the assessment.
Okay.
So yeah.
Okay, thanks.
Okay, Hannah, what are the important things that you found from your subjective assessment?
Well, the important things that her legs are painful and she can't walk as much as usual.
What about Kiara's functional mobility? How would you quantify this?
Well, she uses her walking frame most of the time.
What about her GMFCS and FMS?
I don't know, sorry.
Did you identify any red flags from your subjective?
I don't think so.
Okay, and what about a previous intervention? What's important there?
Well, she's had her hips operated on, so they should be fine now. And she's seen everyone at the Children's Hospital and only had the Botox and the new AFOs 4 months ago. So these should be going okay still.
Okay. Do you have any differential diagnoses at this stage to guide your objective assessment?
Not really. Maybe she's just being lazy and doesn't want to walk anymore.
Well, that's probably not why. Think about her musculoskeletal and neurological systems and what could be contributing to her leg pain and reduced walking endurance. Keeping this in mind, what might you want to assess subjectively today?
I might want to see how far she can go and look at her legs as well.
Okay, great. What specifically would you like to assess with her legs?
I can just look at the muscle power, the joint range of motion, the sensation, those kinds of things.
Are there any particular muscles or parts of the leg that you're more interested in?
Yeah, everything except the hip should be okay.
What about the equipment Kiara uses? Did you want to have a look at any of that?
Well, we already saw her walker this morning when she came in. I can check her AFOs, see if they're fitting properly.
Great. What specifically do you want to check about the AFOs?
They might be broken, they might not fit, but they're only 4 months old.
Well, even though they're only 4 months old, they may be causing issues with skin breakdown if they aren't fitting properly. So it's really important that we assess that today.
Yeah, okay.
Is there anything else you'd like to assess?
No, I think that's fine.
All right, let's go back and see Kiara.
We're just gonna have a look at the AFOs, so we'll just take them off.
Hannah, is there anything else you'd like to look at before we take the orthotics off?
Maybe walking? I guess we could have a look at her walking.
That's a great idea.
Is that okay?
Yeah, that's
Yeah, alright. So we'll go and do that. Okay, that's good. Alright, let's go back into the room. Okay, Kiara, let's have a look at your AFOs now.
Do you want me to take them off?
Yeah, sorry, yeah, you can go ahead. Okay.
Hannah, do you want to ask Kiara to see if she'd like to lie down? It might be more comfortable.
Oh, yeah, Do you want to lie down?
Sure.
Okay. Yeah, skin looks fine.
How about you take the socks off first and have another look?
Okay. Do you want to take your socks off?
Yeah.
Okay.
Okay, what can you see then, Hannah?
It all looks fine, I think, you know.
Okay, Kiara, do you mind if I have a little look at your legs? I'm just going to bring the bed up a little bit first. Is that alright?
Yeah.
Don't jump off it. Alright, let's have a look at your skin. Hannah, can you see how it's really red over her malleoli?
Mm-hmm.
And particularly her heels?
Mm-hmm.
Is that where it's hurting, Kiara? Okay, I'm just going to look at a few more things. Is that alright? I feel okay? This might be a bit stretchy. Did you want to have another look at her range of motion? Maybe using another measure?
Yeah.
Okay. What measures do we have available?
I'm not sure.
Okay, how about you have a go at the goniometer?
Oh, yeah, okay.
Would you like some help there?
Yeah.
Okay. Do you want to hold it?
And
Okay.
this.
Do you want to hold that one too?
Yep.
You got it lined up?
Yeah.
Okay. Alright. Do you want to write down that range? And I'll just have a little feel as well. That's
Yeah.
alright? So Hannah, what have you found?
Well, with Kiara's walking, she's up on her toes a lot. And I think she's got increased tone in her legs, specifically her calves. And I think her AFOs might be a bit tight.
Okay. Why do you think Kiara might be up on her toes, and why do you think her orthotics are a little tight?
Maybe she hasn't been doing her calf stretches.
Could you think of any other more likely reasons?
Maybe the Botox has worn off.
Well, she only had her Botox injections 4 months ago, so they should be taking some effect still. I think it's more likely she's had a growth spurt. Alex, have you noticed any growth recently?
Yeah, actually, I hadn't noticed in her school uniforms because it's a new school, but her jeans are shorter when she wears those. Yeah, so that would fit.
Hannah, is there a way that we could help Kiara to improve her pain and increase her walking endurance?
We could get her to do more calf stretches.
Well, I don't think adding more calf stretches is going to be the most effective way of targeting Kiara's current issues. Can you think of any other treatment options that we have?
Does she need to see her ortho doctor? Or maybe she can do the calf releases. She should go back to the children's hospital to see them.
Well, I think we need to look at conservative options first. Serial casting has been shown to have a nice effective prolonged stretch on the muscles and might help to improve her pain and also her walking. We can certainly liaise with the Children's Hospital about that, keep them updated, and if we need to refer on in the future we can, but we're not looking at surgery right now, so don't worry. If we do a serial casting series, we'll also need to liaise with the Children's Hospital about getting some new orthotics at the end of that.
Sure.
Kiara, have you had serial casting in the past?
Yeah, I always get to choose a colour.
We have had to do a few series in the past, so if you think we need to do another one, then we could probably manage it.
Have you had any troubles with it in the past?
No, not usually. Once we got it wet, didn't we, Kiara? And you got a nasty rash, but normally it's fine.
Well, Hannah, how often will we need to change the casts?
I think every week or so.
That's right. So we'll put a cast on for a week, then we can take it off, have a look at how she's going with her range and also look at her skin.
That sounds fine.
We could probably start a casting series now if that's okay with you.
I think that would be all right. Do you think, Kiara?
Yeah, luckily we're not doing swimming until next term. I really don't want to miss out on that.
Yeah, that's true.
Before we go to the casting room, is there any other equipment you'd like to have a look at?
I don't think so.
Okay. What about with her growth? What might we need to change?
Oh, yeah. She was a little bit hunched over in the K-walker, so we might just adjust that a little bit so she's not as hunched over.
Okay.
So we can do that on the way out.
Sounds good.
Okay.
Are there any other questions you guys have?
No, I think that's all good.
Okay, we can go get started.
Okay.